Welcome back to the Mountain Morning Show. Right now, we are going to have a very important conversation about the importance of mental health, substance abuse awareness here in the county. And for that, I have Mary Christa Smith from Communities That Care, as well as Carolyn Rose, who is the Nursing Director of the Summit County Health Department. How are you two doing this morning?
Wonderful.
Thanks for coming on. I really appreciate it. Can we just start with an overview of what the Summit County Mental Health Alliance is, as well as Communities That Care?
Certainly. So in 2017, the Summit County Mental Wellness Alliance was formed in response to a needs assessment that was administered by the Summit County Health Department. And we identified that we have a desperate need for services within our community for mental wellness, mental health type of services and support. And so the Alliance was formed in partnership with Valley Behavioral Health, Park City Hospital, all 3 school districts, North Summit, South Summit, Park City, the Health Department, Connect, the Park City Community Foundation, to be an organizing hub, recognizing that no one entity could solve all of these problems individually, but that collectively we can work together to do so. And so Communities That Care is a national program that has been used in many, many communities across the country and internationally, and it's evidence-based that helps communities organize themselves around youth prevention, and it's a data-driven program. So Communities That Care is the process that's used by the Mental Wellness Alliance to strategically plan and implement youth prevention programs.
And was Communities That Care, in your opinion, was that the best, most feasible way of accomplishing the goals that are very important to the Mental Health Alliance, Mental Wellness Alliance? Was that resource the most, the best avenue of accomplishing these goals? Is that why you chose Communities That Care?
That's why it was chosen. It was actually chosen prior to me being hired. So it was chosen from the executive team of the Mental Wellness Alliance, along with Dr. Ember Conley and the superintendents Jerry Holmes and Chad Sorensen from North and South Summit, as well as other members of that executive team, Ollie Wilder from the Park City Community Foundation. They vetted all kinds of prevention strategies and models, and they selected Communities That Care, and then hired me to coordinate those programs in August of this year.
Excellent. And Carolyn, can you kind of speak on why it was so important for the Summit County Health Department to take on this mental health wellness initiative?
Well, public health is community wellness. It's a group wellness prevention, and that's what our motto is: prevent, protect, promote. And so it just felt like a good fit at the time, and it still is, and we've been moving forward with it.
And the needs are there, so,
yes, definitely.
So they need to be met. And you guys are on the heels of a community assessment report, which is obviously the big factor that comes into play with Communities That Care, because it is a data-driven, fact-based, evidence-based resource. And so can you guys kind of explain what your guys' 2017 community assessment report was?
Would you like to lead
Sure.
on that?
So it's not an entire community assessment. It's actually an assessment of kids in school from grades, well, actually from birth until 12th grade. And what it will do then is it also affects the older kids, because we start when we're little and we go forward. So what we did is there was a group of volunteers called the Data Group, and we got together and we looked at the SHARP survey. So the SHARP survey is a national survey, and it's actually written by the Communities That Care program. And it is administered to most every school. It is an opt-in type of a survey, so that means that the kids don't have to take it if they don't want to. However, it has some really important data in it, data elements.
I was going to ask, what insights does this survey provide to Communities That Care?
It looks at kids' views on 4 different domains. So family, community, peer, and individual. And within those domains, there are certain elements that the kids are asked questions about, and then it's double asked to make sure that, you know, somebody's not saying, oh yeah, I'm going to put here I smoke, but I really don't. And so it's those kinds of questions then are asked in another way further on in the survey. So we took those results and looked at them and thought, you know what, we need more than just this one data set. So then we looked at some of the public health data sets that we have available to us. We also looked looked at some of the specific school data like absenteeism, graduation rates, and that sort of thing. But the most important part was having people from each of the 3 communities involved in the discussion on this. Because you can look at something on paper and go, yeah, okay, is this right or is this not right? And so it was very important to have the input of these communities to say, you know, yeah, that really is a problem, or no, you know, I'm not seeing that as a problem. And then if they're not seeing it as a problem, then we look to other data sets and other information that's out available to us to either confirm or deny that that's a good thing to do.
And what conclusions did you guys draw from the data that was analyzed for this last year?
So the students were asked questions about their use, about perceived risk of using drugs, availability. They also looked at commitments to school, availability of handguns, all kinds of things. And if you want, you can go in and see the SHARP survey. It's available online. But what we found is that and we took this back to our broader committee. So the data work group did their work and then brought it back to the broader committee for them to process through and select 3 priorities. We know we can't do everything, so we need to focus where we can be most effective and where the need is. And those 3 priority risk factors are the first one being perceived risk of substance use, and what we see is the kids in general don't believe that it's risky to use. And we also saw in the data the second risk factor being parental attitudes, and whether it's permissiveness or denial. But one of the really interesting components within that particular risk factor is when the students were asked if you're using alcohol, where are you using it? And 70% of the students who reported using alcohol said the #1 place they used it is at home with their parents' permission. So that's telling us something, and that was countywide, that was not just Park City. And the third risk factor that was selected is mental health. And in the survey it was called depressive symptoms, but the committee wanted to make that a more digestible and broad term. And also to recognize that so much of what drives substance abuse can come from a root cause of a mental health issue, whether it's anxiety, stress, depression, what have you. And so those are the 3 risk factors: parental attitudes, perceived risk of drug use, and mental health.
Wow, and so it seems like a lot of this starts obviously at home. It's with the first contact of these substances, it's the first perception of what they mean and what the risks are, so it's very important. And with all of these data points and with all this information, what are the priorities for communities that care for this year? What are you guys going to do with this information and this data?
Our next step is to do a resource assessment. We have amazing organizations within our community that are working in the prevention space with young people, and so today and going forward we have a resource assessment work group to gather together information about every organization, school, and entity that is providing prevention resources. And then we look to see, are there gaps between what we have available and what is needed. And we look for tested and effective programs. We want programs that have data behind them, that have been proven effective, so that we're putting our resources going forward into programs we know will have the impact we're seeking.
So obviously this information is very crucial because you guys are going to be throwing resources where they need to be put, where the most need is for that. And so Carolyn, how can we as a county, as a community help assist in this whole process? What can we do as a community to help this?
I think that following what we're doing and reading the updates when they become available, participating, looking and really looking at these really are the problems, and knowing that there are resources out there. Sometimes you just need to access them, or the new resources, and participate in your schools, in your community, in your neighborhood. Pay attention to what's going on with the kids. tell them they're doing a good job, tell them that they're not allowed to smoke in front of your house, whatever, things like that. So I think that we'll be coming out with recommendations further on in the process that we go.
And I think you made a great point about a community involvement, because one of the big data points that I saw in this report was that youth, especially who don't feel connected and interwoven in their community, that's a huge leading factor to not only mental health but substance abuse, which can lead to further issues. So I agree. And where can people keep up with the updates, as you had said? What's a good resource for them to stay up to date?
You can go to the Summit County Health website, summitcountyhealth.org, and there is a web page for the Alliance, and we will post the community assessment report in the next few weeks on that website, and also provide a survey for feedback to the community. You can sign up for the Alliance newsletter there as well. And so that is a wonderful resource. And if you, as an organization, have events that you're putting on that are related to mental health, we have a community events calendar on that website as well, in an effort to capture all of the different programs and seminars that are happening in the community, so that you can promote your work there and also access what's happening.
Well, both of you, thank you so much for coming on. I want to make sure that I didn't miss anything that was very important that you guys wanted to speak about today. Is there anything that I didn't cover that? Excellent. Well, because it is such it's such an important topic, and I think it's something that needs to be talked about more. I feel like a lot of people are kind of cautious to talk about it because of the stigma that goes along with all of it. So thank you so much to the both of you for coming on and spreading this awareness with us.
Thank you.
Absolutely.
Thanks for having us.
We'll be right back with much more right after this break, so don't go anywhere.